I want to let you guys in on a secret today. One thing that I wish all my patients knew about neuromas was the actual underlying cause. The underlying cause is really how flexible the forefoot is, and controlling this makes treatment so much more effective for treating neuromas. One of the main focuses of treatment is an injection, or you can do an anti-inflammatory medication to help control the swelling in the nerve. But the main thing is that the overall cause of a neuroma is really the flexibility of the forefoot. So for every toe that you have a corresponding longer bone. It's called a metatarsal. And the nerves that go to your toes actually run in between these longer metatarsal bones. So what happens is the nerve runs in between these long metatarsal bones, and it divides into two, and it feeds the toes. So what happens with patients with a hypermobile foot is that the foot should be held in a nice, locked, steady position when we walk. A lot of the times what happens is the forefoot is allowed to move in an uncontrolled motion when we walk and when we wear unsupportive shoe gear. Now, when that's occurring, these longer metatarsal bones are basically moving over one another. It's as if these bones were allowed to move freely. And then what will happen is the nerve that runs in between the long bones gets exerted to friction and pressure. So you can imagine that if there were nerves running in between these long bones, and these long metatarsals were allowed to move over one another so freely, a lot of friction and pressure would be placed on that nerve. That causes the irritation, and that causes the neuroma. All right, so now that we've addressed that the underlying problem of a neuroma is the flexibility of the forefoot, the best way to really help control that is through an orthotic device. An orthotic device is an insert that goes inside the shoe. The main purpose of it is to help control that forefoot motion. The joints of the rear foot and midfoot are held in their appropriate positions so that the forefoot is held in a locked position, and that flexibility that causes those long metatarsals to move over one another, causing the nerve irritation, is eliminated. Now, it's going to take some time between when a custom orthotic can be made and now. So the whole thing about it is that we want to bridge the gap between when your orthotics are made and now. So the best way to do that is to do what's called a neuroma strapping padding. So what you want to do is you want to take a roll of elastoplast tape. It's a stretchy tape. You apply the first layer with the sticky side out, and the elastoplast is a great stretchy material because it's also going to help to decompress that swelling in the forefoot when you have a neuroma. So that first layer goes on just like so. You want to provide gentle compression, and you want to take into consideration the ball of the foot. You want that taping to be just behind the ball of the foot. Cut your piece of tape. Now the next part is the pad. This pad, as you can see, has a wider top. The wider top then becomes lined up parallel with the ball of the foot. So when you place the pad on, you want it to line up just behind the ball of the foot. This is going to effectively help separate the long metatarsal bones of the foot, again placing less pressure on that nerve and neuroma. Your final layer, so that you can quickly remove this on and off, is accomplished through this top layer where you want both sticky sides to meet. Again, provide some gentle compression so that the swelling that's in the forefoot can be controlled as well. Cut your piece of tape. Now, you want the patient to be able to place this in its best position. So what I like to do is have the patient align it up by drawing an arrow in between the first and second toes so that they'll know where exactly that pad needs to line up, and they'll know by the arrow in between first and second toes. Then you've got a nice removable padding and strapping that you can easily take on and off. Now what I'm going to do is I'm going to go ahead and I'm going to cut the loose tape edges so that they do not become irritating. This will also help to make shoe fit much better as well. So that it won't be so bulky in the shoes, and it's a little bit more comfortable as well. So just like we said before, line up that arrow in between the first and second toes, feel the ball of the foot, and that padding again goes just behind the ball of the foot. So, arrow in between first and second toes, slips on very nicely, and this is exactly where we want that pad to line up. It is reducing the pressure on the neuroma.